I appreciate the great job that's been done by my colleagues from Missouri and from Alabama and from New Hampshire in pointing out many of the concerns that we have with regard to this bill and why we think this is a bad direction to go for the country. And you've heard my colleagues talk about the massive expansion of government, the taxes, the premium increases, and obviously the very, very serious problem that we have with our national debt and the deficits that we're racking up every single year to the tune of about $1 trillion, and north of there, this last year, $1.4 trillion, and we're on a pathway to hit that target again this year. And I think I've heard my colleagues here in the Senate on the other side talk repeatedly about the Republicans not having their own solutions, their own plans. Well, I have to say, maybe the reason that they haven't been seeing the Republican solutions is because they have been hiding behind this voluminous 2,100-page bill at a cost of $1.2 billion per page. Now, Republicans, I can probably say hundreds of times, if not thousands of times, have come down here on the floor and outlined a step-by-step solution to dealing with the health care crisis in this country and the concerns that most Americans have, which is the high cost of health care. But unfortunately, I think many of my colleagues on the other side perhaps have not been able to see that because they can't see around this $2.5 trillion expansion of the federal government that they seem intent on pushing through the United States Senate. Now, Republicans have talked about buying insurance across state lines, about small business health plans, about tort reform, about incentives for wellness and chronic disease management. There are a whole range of things that could be done to address the concerns that the American people have about the high cost of health care that don't involve a $2.5 trillion expansion of the government, a 2,100-page bill at a cost of $1.2 billion per page. Well, Madam President, the other thing that I've heard my colleagues come down here on the other side and say is, we've got to do something. People in this country are dealing with high cost of health care, and they are. We all hear it. We hear it from small businesses. We hear it from families. We hear it from individuals. Everybody is concerned about the high cost of health care in this country. In fact, a number of my colleagues have come down here on the other side and said, of all the bankruptcies that occur in this country every single year, most of them occur because of the high cost of health care. Well, get this, America. Under their proposal, you're going to go bankrupt sooner because they drive the cost of health care up. They don't do anything to bend the cost curve down. I want to show you a chart, Madam President, which points out what happens to the cost curve under the Democrat plan that we are talking about here in the United States Senate. The blue represents the current cost curve. That is the increase in health care costs in this country that we would see if nothing was done. Just year-over-year increases as it goes out into the future. Now, what you would expect if you were going to reform health care is you would want to see that line start to bend down a little bit so that health care costs, health care increases go down over time instead of going up. But what happens? Under this proposal, and this is the Congressional Budget Office. This isn't what I'm saying or any of my Republican colleagues here on the floor are saying, Madam President. This is what the CBO, the Congressional Budget Office, says. This would actually, under the Democrat plan that we're talking about here today, increase the cost of health care. It bends the cost curve up. $160 billion more will be spent on health care in this country if their plan gets enacted. So all those people out there who are concerned about the high cost of health care today aren't getting any relief under the Democrat plan. In fact, their lives are going to get much, much worse. And particularly, Madam President, those who already have health care. Now, there are some in this proposal who will get some subsidies to buy insurance in a health care exchange. That affects about 19 million Americans. But there are 182 million Americans who currently have health care in this country who, if this bill passes, are going to be faced with higher taxes and higher premiums. That's just the way it works. They aren't eligible for getting any subsidies to buying the insurance, and in fact, they don't have any more options available to them. What they're facing is higher taxes that they're going to be faced with under this bill, as well as higher premium costs. And so, Madam President, if you're the average person in this country who is worried about costs, which I think most Americans are, and you're watching what's happening here in Washington, D.C., you've got to be asking yourself, what is the whole purpose of going through a health care reform debate if, in fact, it doesn't do anything to drive down the cost of health care? Now, my colleagues have pointed out that when you spend $2.5 trillion, when you expand the federal government by $2.5 trillion, when you raise taxes on medical device manufacturers, on prescription drugs, on health plans themselves, and when you cut Medicare providers, and if you believe this, and I mean, this is something that seems almost, it's hard to fathom that any of this would ever take effect, but this is all paid for. This $2.5 trillion expansion is paid for in the form of Medicare cuts and tax increases. Tax increases, when it's fully implemented over a 10-year period, as the senator from New Hampshire has pointed out, about $1.2 trillion in tax increases, about $1.1 trillion in Medicare cuts. Now, who in this chamber really believes that $1.1 trillion in Medicare cuts is going to occur? There was a discussion earlier between the senator from New Hampshire and the senator from Missouri about what happened a few years ago when the senator from New Hampshire was the chairman of the Budget Committee and proposed cutting $10 billion out of Medicare over a 5-year period, which amounts to $2 billion a year. And what we're talking about here is $1.1 trillion over 10 when fully implemented, or $100 billion a year. When he proposed cutting $2 trillion a year over 5 out of Medicare, there wasn't a single Democrat vote in support of that. In fact, the Vice President of the United States had to come back from a trip to Pakistan to vote on this, to try and reduce Medicare by $10 billion. They're talking about, when it's fully implemented, $1 trillion in Medicare cuts. And you know who that hits? Yes, sir. I'd be happy to yield to the senator from New Hampshire.
Where that cut is proposed to primarily fall. I don't know. Is Medicare Advantage used by a number of seniors in South Dakota?
It is, and I assume it is in New Hampshire.
Under this plan, it will be eliminated.
The plan with those who get benefits
that's
under
where
Medicare,
primary savings is from.
That's where a big share of the savings is going to hit senior citizens right squarely between the eyes if they get benefits under Medicare Advantage. $135 billion comes from hospitals, $15 billion from nursing homes, $40 billion from home health agencies, and $8 billion from hospices. Now, does anybody really believe that all that's going to happen? And if it doesn't happen, guess what? It all goes on the federal debt. It all goes on the federal debt. Now, I thought it was interesting that last week when the president was in Asia, that the Chinese raised the issue with him about what happens if health care reform passes in this country. And they weren't worried about universal coverage or a public option. You know what they were worried about? What impact it's going to have on the deficit. And in fact, according to the New York Times, in their reporting on his trip, the Chinese wanted to know in painstaking detail how the health care plan would affect the deficit, said one participant. They're worried about their investment because they're the biggest buyer of American debt. What happens if all these Medicare cuts that are proposed, and we couldn't get 51 votes to cut $2 billion a year out of Medicare a few short years ago? They're talking about cutting, when it's fully implemented, $100 billion a year. Does anybody really believe that we're going to cut $15 billion out of nursing homes? I don't think so. And so here we are. How do we pay for it? Well, if it doesn't paid for in Medicare cuts or tax increases, it all goes on the federal debt, which is growing at over $1 trillion a year. Mr. President, this is a bad deal for the American taxpayer. It's a bad deal for the 182 million Americans who already have insurance. They don't get anything out of this. What do they get? Higher taxes, higher premiums. Don't listen to me. Listen to what the CBO says. $160 billion in additional health care costs over this time period. It bends the cost curve not down, but up. That's what you get. Now, that's why so many people, so many organizations, business organizations have come out opposed to this, because they know the impact it's going to have on small businesses. The best way to get health care coverage to more people in America today, as long as we continue to have an employer-based health care system, is to get people a job. People in this country who are struggling with the economy right now, losing jobs, the thing that we ought to be doing is figuring out how can we provide incentives for small businesses to put people back to work, not how can we kill jobs by raising taxes on small businesses. And that is exactly what we are doing right here. And that's why every business organization, from the National Federation of Independent Business to the Chamber of Commerce, the National Association of Wholesaler Distributors, and right down the list, is opposed to this bill. They know the impact it would have on small businesses and their ability to create jobs. And the best way that you can get a job or get a health insurance today in America, Mr. President, is to get a job. This bill kills jobs.